Hi everyone, welcome to FLA's webinar on gender responsive health protection in the clothing and footwear sector, kindly joined by FEMNET and SÜDWIND Institute. My name is Gülden Ülker, Senior Manager for Social Compliance at the Fair Labor Association. Before we start, I would like to provide some technical information about this meeting. If we go for the next slide. Yeah. Please note that this webinar is a public webinar and is being recorded, and we will be sharing the slides and the recording with the participants after the meeting. And please feel free to use Q&A section to raise any question you might have. Next slide, please. And here is the agenda of today. After introductions, I'll provide quick information on FLA's gender-related work and its upcoming updates for this year. Then our panelists will share their project called Multi-Actor Partnership on Gender-Specific Occupational Health and Safety, where participants can learn more about the details of the project and the next steps. And followingly, we aim to discuss best practices and challenges in supply chains specific to gender and health and safety, as well as respond to any questions you will have for sure. Now, I would like to introduce today's speakers in the next slide. Thank you. I already introduced myself. I work as a senior manager at the FLA and responsible for EMEA region. And I have joined by my colleague, Celia Rubinstein, Social Compliance Senior Program Officer, who will be facilitating the discussion at the end. And we have two wonderful panelists. We have Jiska Kojovcik, I hope I made it, a researcher at the SÜDWIND Institute, which is a research organization, an NGO and a think tank engaging for global justice in economic relationships. And we have Mona Meyer, project lead at FEMNET. FEMNET is a German nonprofit women's rights organization with almost 2 decades of experience in advancing gender equality, labor rights, corporate accountability in global supply chains. Well, we really appreciate their participation for today's webinar. And now, after these introductions, I would like to provide some information and the updates on FLA's gender work plan. We can go for the next slides. I want to quickly start with why we have started with this work plan and initiated a working group on gender topic at the FLA. First point is that, for sure, women represent the majority for the workforce in the supply chains, especially in apparel and footwear sector, which covers the FLA's working scope for sure. And with that, we have included clear goals in our 5-year strategic planning to address risks specific to women, including gender-based violence, inequity, wage discrimination, and such. And the other motivation to initiate this work plan was aligning with the current standards or upcoming standards, especially in Europe, and also aligning with international guidelines such as OECD standards, as FLA has also gone through the OECD alignment assessment process recently. We can go to the next slide. So with the aim of being more intentional about gender, FLA launched its gender work plan in 2024 and aims to achieve these 3 goals that you see on the slide. One of them is research and knowledge building. With that, our aim was strengthening FLA's expertise on gender issues in supply chains through researches, case studies, pilot programs to address gender-based violence and gender inequity. And our second goal is to improve FLA standards and programs by updating FLA standards and principles, improve governance and company accreditation program by aligning with the OECD guidance, addressing gaps and enhancing our assessment and other programs with gender lens. Third goal is to measure impacts with developing innovative tools and solutions to measure and improve gender inequities in supply chains and eventually report progress on that measurements on gender-related issues. We can go to the next slide. So based on the work plan aims that we have mentioned, if you want to look at what we have done last year in 2025, we worked to update FLA's gender resource guide, which already includes list of standards and guidance on gender topic. And in addition to existed guidance, the update we made included more gender-based violence issues and union and worker representation topic specifically. We piloted gender disaggregated wage data collection last year in 4 factories and launched FLA's gender pay equity tool to measure gender pay gap within the worker occupations. And this tool has been added to existing fair compensation toolkit that we have. And you can see that at our website, FLA website, and link is copied to the slide, as you can see, as we are going to share the slides later on. And other relevant work we did is conducting research to inform FLA standards and principle revision process, including incorporating feedback from FLA's OECD alignment assessment feedback. And as an internal gender equity improvements, gender working group at the FLA provided a learning session to all staff, FLA staff, and reviewed and we have reviewed internal policies for gender lens improvements, such as HR policies. Next slide, please. For 2026, as mentioned, research and knowledge building was one of our main focus in the past years to be able to build more on practice in the future. So this year we would like to continue to do that, and our research guide will be public soon after completion of all the updates we are making. And we plan to continue to update this guidance. In addition, we developed an e-learning module on business case, which will be available in Fair Labor Training dashboard soon, where you can find company best practices on this topic. And we plan to analyze our CI assessment data on gender-based violence, harassment and abuse, non-discrimination findings, as well as continue to do wage data analysis, which is also linking to special project goal in here, actually. As mentioned, we started to collect gender disaggregated data last year. And in 2026, FLA will expand its gender equity wage data collection efforts to all factories assessed in some countries, such as Indonesia, Vietnam, Bangladesh, and Central America, estimating about 30 factories. Then FLA plans to prepare a learnings analysis report following this year's pilot cycle. Another pillar of next plan is standard updates. I already mentioned that we have started to work on this last year. Now we are in the phase of integrating gender lens into our principal updates, along with the other updates, including OECD alignment assessment feedback. For internal development of our organization, this year we plan to continue to adopt internal policies to be more gender specific and also check more on training opportunities for staff on gender lens. Lastly, stakeholder engagement is our other focus for this year's work plan. And this webinar is one of the engagement opportunities that we were aiming for. And possible roundtables or engagement is in planning phase for most probably on gender-based violence topic and gender pay equity. Now I would like to hand it over to Mona to present on their projects. If you go to next slide, project called Multi-Actor Partnership on Gender-Specific Occupational Health and Safety. Over to you, Mona. You are muted.
Yeah. Now I'm not anymore. So thank you, Gülden, for the introduction. Also, hello and a warm welcome from my side. I'm happy that so many of you came to our little session. If you could go to the next slide. Today, we would like to introduce to you our project, which is a multi-actor partnership, gender-specific OSH, and we would like to introduce you as well to the concept of GOSH, which is the acronym we use for gender-responsive occupational safety and health. And firstly, I will be quickly introducing you to the background of the project, and then Jiska will give you a little overview of what we mean by GOSH and why we think it is relevant. And then I would just give you a few examples of what we have done in the project. And with that, we would like to answer the question, how can GOSH be practiced? So next slide, please. The multi-actor partnership is an initiative that was initiated by 4 organizations. These are the Trade Union Rights Center, TUSC in Indonesia, CVDEP in India, and FEMNET and SÜDWIND in Germany. And the goal of the project is to improve the health situation of women workers in the garment and footwear industry in India and Indonesia. It started in 2021 and it has now just entered its second phase with fundings by the Federal Ministry for Economic Cooperation and Development, the German ministry, until the year 2029. And in the project so far, and we also continue with that, we do have 4 strategies that we're using. And one of them is knowledge creation. And this is actually really fitting to what you have said before, Gurden, that we think that the basis for everything is creating knowledge. So we did start with knowledge creation, and the knowledge process is an ongoing process for us. So we're still learning more about gender-specific health risks. We also established dialogue structures, regional ones, but also transnational ones. We'll be talking more about that later on. From the knowledge creation, we also developed a set of guidelines, which is strategy number 3. And then strategy number 4 is the implementation of these guidelines in pilot factories. Next slide, please. And because we think that GOSH, gender-specific occupational safety and health, is really specific from country to country, or actually we know it because the data is showing it from country to country and also region to region. I just wanted to quickly show you which regions we have been working within the project. And in Indonesia, we have been working in Western and Central Java and in Jakarta. In these regions, we find really big footwear factories. And in Jakarta, we have also been working with home-based workers. And for India, which is on the next slide, we are in southern India, mainly around Bangalore and in Tamil Nadu. And here we work together with garment factories, and we have set a focus on migrant workers. And this is to set the topic. And now I'm handing over to you, Jiska, to give us some more insights into what is GOSH and why it is relevant.
Yes, thank you, Mona. Thank you very much. So I will talk a little bit more about the context of the industries and gender norms in that context, of course, always with a specific eye on India and Indonesia. But as you know, in the whole industry, most workers are women, as Gulden has said before. It's approximately 80% according to the International Labour Organization. And they frequently also belong to other marginalized groups, like certain castes, age groups, or ethnic minorities, etc. So why are so many women and marginalized people hired? This is partly due to the patriarchal societal norms themselves. They are expected to behave in an adaptable and unobtrusive manner, you might say. And even if you ask some workers, they say themselves that they believe this is the reason they are hired. Why don't they do anything else? Because they often have no alternative. Or rather, let's say workers who have no alternative are recruited for such industries. You see this, for example, when from rural areas where agriculture is not possible as means for survival anymore, then young population is targeted as workforce. Either manufacturing is moving to those regions or workers are attracted to go to the cities. So what I'm saying now for the context, of course, is not exclusively true for the garment sector or specific countries. You may find those patterns also in your countries. You know, we have a gender pay gap where women earn less than men for the same or equivalent work, even with the same qualifications. We have a lot of women and marginalized groups in precarious employment. That is insecure, low paying, physically demanding. The textile and footwear industry are examples, but you might also think of cleaning or caregiving. Then we know the whole idea how work is organized, the schedules, they cater to particular lives, let's say. And I'm reading a quote from an American scholar from 2006 called Acker. She says, in general, work is organized on the image of a white man who is totally dedicated to the work and who has no responsibilities for children or family demands other than earning a living. 8 hours of continuous work away from the living space, arrival on time, total attention to the work, and long hours if requested. And flexibility, of course, to bend these expectations is more available to high-level managers, predominantly men, than to lower-level managers. And what is already mentioned here also is the invisibility of care work that often is more a burden to women than to men. When we come to the organizational part and voice, it was already mentioned before that we should have a look at underrepresentation of women in marginalized groups. That is true when it comes to work councils, OSH committees, also leadership positions, of course, but it's also true for governments and other decision-making bodies. And we know that also in trade unions and in corporate management, whenever it comes to collective bargaining, political discourse, women voices and needs and risks are not adequately represented and addressed. The same is true for access to justice and compensation. We know from studies that also here we find patterns of discrimination. For example, if you think of a workplace accident or mental health conditions, they are often not taken seriously in courts and in court procedures, or resources are lacking to use those opportunities, etc. And of course, we have a huge data gap for many gender-related issues where we just don't know what exactly is going on. That said, health has long been a neglected focus, even within civil society and labor unions, even though the burden on workers is often heavy. And one indicator of this for us is the number of years worked in the industry. And if you think about the garment industry in India or the footwear industry in Indonesia, you hardly find workers older than 35 in the organized factories in formal employment. It's different for home-based work, but in formal employment, often really people are worn out by the age of 35 or 40, maybe the latest. So why should we start looking closer with what you see here as the GOSH approach? Because what we don't see or choose not to see can really harm our employees, the productivity as well, and also our reputation. And I sometimes say now, imagine you had a workforce in the factories that was skilled, experienced, and healthy at the same time. So core elements of our approach now are that, first of all, we recognize that gender roles are socially constructed. They're not a given, they're changeable. What we see is typical for men or typical for women. All those things I just mentioned, they can be changed. And for that, we need an intersectional perspective to reduce structural inequalities. That means we understand that aspects such as class, ethnicity, migration, background, and gender, they're all interrelated when it comes to discriminatory patterns. We want to co-create work environments that promote the health and safety of all workers, and especially those that are usually marginalized. That means that we need active involvement of those infected And we need gender-specific risk analysis. And for that, very much localized knowledge. We need to know what are the precise mechanisms of discrimination, what are the different perspectives in a very particular region or place. Then, of course, we reflect on the norms and the status quo, and we need willingness from all participants to challenge what is the status quo. So if you move to the next slide, please. The gender lens is really like glasses that help us uncover hidden structures and assumptions and relationships and power dynamics. And if I say this now, of course, this sounds very theoretical, but of course, those now theoretical concepts, they're the basis for real life decisions in the workplace. And we will now move to the next slide and look at a picture with you to think a little bit with those glasses that I just mentioned. And I would like to ask you to reflect on the picture that you see. Don't move to the Mentimeter right away. Stick with the picture for, let's say, about a minute. And no, there is no right or wrong answer. The art piece is bigger than the artist. So just look at the picture and think about what you see, what it tells you, what it makes you feel. And you will have the chance to share your reflection very briefly in a minute with the mentee. Look closely again. And then you can move to the mentee question, where you are asked to use just a few words, just what comes to your mind to describe what you see. Doesn't need to be a full sentence, doesn't need to make sense for your English teacher. So now we see that many people saw tiredness and discomfort. I also see high output. Oh, you see overtime. Okay. So thank you very much for sharing. Can we go to the slide before, please? Without judging what you saw, yeah, the one after that with the picture. Yeah, thank you very much. So without judging what you saw, I now just want to give you a little insight what we thought when we came up with this picture in the project based on the studies that we've done and the conversations that we had with workers in both regions. So imagine you are the woman in the middle here, and you work in a group with a group target for the hour and a target for the day. And everyone's wages are very low, and most of the colleagues are the backbones of their families, also financially, with their income. And everyone gets a small bonus if you reach the target. And you may feel deductions for the group or overtime for everyone if, as a group, you do not reach the target. Now, you're already behind, of course, because the target has been set much too high. And now the question is, would you risk everyone's target, everyone's extra bonus with just taking a sip of water? Or would you maybe risk a bladder infection at 30 degrees or more in the room? Would you get up to use the bathroom when you have your menstruation? The reason why I'm asking those questions is that often we answer to challenges in ARCH with education. We think it's the woman that doesn't know she would have to take a drink or go to the restroom. What we are saying with our GOSH approach is that it's a question of the structures that make it very, very difficult for you, if you were the worker, for me, if I was the worker, to decide to protect my house. So we have many examples like this. And maybe if you think about the codes of conduct for your value chain, and you probably have zero tolerance policies, you can think about how many of them are on fire safety or on machine maintenance or anything related with a building. Probably there are a few zero tolerance policies. And now think again, how many are about recreation time, about break times or access to clean water, or how many are about protecting pregnant employees from heavy lifting or exposure to toxic chemicals? So it's just a little bit about getting your mind moving around those topics in your companies. Of course, gender justice in ARCH is not about one size fits all policies. As I said, there's a lot of local knowledge involved. And now Mona will explain to you how we're doing it in the multi-actors partnership and how we're trying to live up to the standards that we have created with the approach.
Thank you so much, Jiska, for taking us through all of that and setting the focus. As Jiska said, I would just like to dive a little deeper with you into the project and the activities that we're doing. So if you could move to the next slide, please. Next one as well. One more. Yeah, perfect. Here we are. And as I have said before, we see knowledge building as the basis for everything. And that is why we have started a project with a set of interviews with female workers. And our partners in India and Indonesia, they have done a lot of focus group discussions, but they have also used other approaches. In the picture, you actually see a group of workers in India doing a body mapping exercise where they were like showing on the picture where they feel body pain. And this was also done outside the factory. And before and after, like a lot of other conversation happened to actually create a trustful environment. And then next to like talking to the workers themselves, we have also set up so-called core groups, which is just like a group of different experts from different fields. Like we have doctors, we have people from universities, we have trade unions, and these people also then they were coming together to actually prepare the focus group discussions, but they were also coming together to afterwards talk about the interviews and the findings there and to elaborate on them and to set them into context. And then with all that knowledge that was created and that is still created, we kept working. So if you could move to the next slide, please. Oh no, there's one slide more. I forgot about that. The interviews, and they were then like they were brought to the core groups, and together with the core groups, the partners in India and Indonesia, they classified the gender-specific health risks into different categories. And what was found is that the health risks that you see on the slide now are the most common ones. And we see musculoskeletal health risks, such as especially neck pain and back pain. We see reproductive health risks. A lot of workers reported that they had miscarriages. Some of them also were undergoing hysterectomies. We see a lot of mental health risks due to the high targets, as Jiska has mentioned before, but also due to the really to the double burden that a lot of workers face, being the backbone of their families, as Jiska has said before as well. We see gender-based violence and harassment, verbal abuses, but as well as physical abuses. We see nutritional health risks, especially in India. A lot of the workers were anemic. But also we find systematic health risks, saying that women workers often have like weaker access to healthcare systems, especially the public ones. In India, we found that 30% of the salaries of women workers were often spent on private health support because they could not use the public health support due to their working hours, and also they had to buy supplements and other medical things because the conditions in the factory did not allow them to drink enough or to eat properly. So the systematic health risks are also play a really important role in the project itself. If you could move to the next slide, please. And then out of these out of the study and out of the health risks that have been identified, we developed a set of guidelines, a really big set of guidelines. So we came up with a lot of guidelines for the different areas, and for each category, we have come up with different guidelines that vary. And so like here we see it's really small. I don't know if you can see it, but here I put like some guidelines for mental health, and they vary and they go from information material to trainings to actually providing more time, more break times, but also also like raising or coming up with ideas such as implementing childcare facilities at the factory so that women workers can know that their child is being taken care of while they're working, which would also lead to a lot of stress relief. And the idea behind having such a wide range of measures is that each factory can then choose individually which measures are the most relevant ones and which ones are also feasible. And then next slide, please. And these guidelines are now jointly implemented at the pilot factories. And here it is really important that it is a joint process where workers, but also management, brands, trade unions, and all stakeholders are actually involved when it comes to choosing the action points. And I brought you a few pictures from a guideline implementation kickoff in India. And you see that on one picture, there was a discussion with the factory management where they have been walked through the guidelines, and then they have decided which guidelines they would like to implement. The same thing happened with the workers, and then they came together and they together decided which guidelines to choose and which ones to prioritize. You also see like how they did it, because I think like they were going through all the guidelines and then they marked which ones are the ones that are feasible. So they marked them green, and which ones are the ones that they would like to have, but they might not seem so feasible right now, which ones are already implemented. Yes, so that is how it was done. And the implementation of the guidelines is also monitored and evaluated. And for that, the project team in India and Indonesia is actually training the committees that are already existing at the factory, so that also these committees, or we use the infrastructure that is already there, and we actually give the committees a bigger voice within the factory setting. Next slide, please. And for you to better understand what is actually happening at the factories, I just prepared this slide where I show you which are the focus topics for each factory. So in Indonesia, they have chosen mental health as a focus topic, and they have done mental health trainings, but they have also developed a tool which workers can use to actually better assess the mental health status of the workers. And also they have chosen to provide free sanitary napkins, and the provision of free sanitary napkins is actually a guideline that factories like to choose at the beginning because it's really easy to implement, and it is giving workers a good feeling right away, which is also then leading to having a better setting or creating a better atmosphere for the implementation of other measures as well. In India, the focus was set on musculoskeletal health and reproductive health, and they have also provided free sanitary napkins, but they have also provided anti-fatigue mats for workers to have more rest during their break time, during their lunch break especially. And they have also done trainings on hygiene. And in the other factory in India, the focus was set on musculoskeletal health and access to healthcare. And here they started to do more breaks, more breaks during the workday. And in those breaks, they were also shown a few exercises for musculoskeletal benefits. They were also providing resting rooms, and they are now cooperating with ESI to have more workers use their ESI cards and just be aware of the benefits that come with it. And looking at the implementation of the guidelines, it's also to be said that we have started with a first it will write like 3 to 6 month implementation phase, and we are now getting the monitoring results and all the guideline implementation, all the guidelines or the implementation at the different factories will then be evaluated. And then afterwards, the pilots choose more or other measures, or they might adapt some of the measures that they have already been implementing. So the guideline implementation is an ongoing process. Just for you to better understand what it actually means. And next to the guideline implementation, if we move to the next slide, it is also really important that this project is not only about piloting and the guideline implementation, but it's also about dialogue structures that we would like to establish, or we have been establishing around it. And we do have established also various dialogue structures. One thing, this is like the first smaller thing, is actually the newsletter. And we have come up with a newsletter that is being published once a year, where we provide information about the project, where we portray workers, and where we just briefly discuss current developments. So if you would like to subscribe to our newsletter to be in touch with us and the project, you can do that via the QR code, or I might later on share the link in the chat. And then other dialogue structures that we have established is a transnational dialogue forum, where we bring together the different stakeholders from the pilots, but also with the transnational ones, and also stakeholders that are just interested in the project. And in these transnational dialogues, we make sure that also workers can speak up, or workers' representatives. But we also would like to inform and discuss topics from the project itself. So we plan to host another dialogue forum this year towards autumn of 2026. And in this dialogue forum, we will most likely discuss the first monitoring results. But no agenda is fixed yet. And other than that, we also have a working group and a learning group. This is actually one that usually there are more stakeholders from the global north, especially brand representatives and MSIs. And in this learning and working group, in the past, we have been discussing about getting gender-specific data, what needs to be done for that. And in the future, it is actually up to the people who come to this working group to also set the agenda for the working group. But what we're planning to do in one of the next meetings is talking about our survey results, which is leading us to the next and last slide of this presentation. We are now doing a survey to better understand and identify the challenges that brands and MSIs face when it comes to bringing the topic of gender and health up front. And with this, we're doing the survey, and we would like to use then later on the working group to actually discuss the results of the work of the survey, and to find strategies how to deal with the current situation. I think that's it for now. Jiska, do you have anything you would like to add to what I have just been saying?
No, maybe one sentence on the guidelines and all those products that were mentioned. They have already been developed in those dialogue structures. So many stakeholders took part in writing the guidelines.
Thank you for that. That's a really relevant topic. And I think we have now come to the end, and we are really excited to now get some more insights from your side, but also to answer your questions. And I think I'm handing over back to Gülden. Or Slil? Are you moderating now? I don't know.
To Slil.
Okay, then I'm handing over to Slil.
Thanks, Mona and Jiska. Well, geez. Thank you so much, Mona and Yiska, for this great presentation. This is such an interesting project, and I can't wait to get to the panel conversation to hear more about it. But first, before we do this, we want to hear from everyone here a little bit more. So we're going to move to another quick Mentimeter poll. Thank you, Michelle. It's essentially the same one that you've had before. So if you are still on the same kind of tab of the first survey, you'll now see the next two questions that we would like to hear from you. And I also encourage you to add questions to the Q&A box. So the first question we want to hear from you is, from everything you heard of or from things that you know, what are the most urgent health concerns raised by women workers in the sector? You can, scan the QR code and add your responses. There are no right or wrong answers based on your knowledge on what you think as well. Reproductive health, definitely. Mental health, yeah, it's hard to choose the most urgent. Maternity leave. You can see that, mental health is gaining more traction, unfortunately. Stress related, heat stress. Yeah, we'll give everyone a few more seconds to add your responses. And also if, these questions kind of bring up other questions, then I encourage you again to put them in the Q&A box. We will address them in a minute during our conversation. Reproductive health, gender-based violence, definitely. I think we've learned that many health concerns are kind of go overlooked. Let's move on to our next question. Thank you, Michelle. And now we want to hear from you. How are these issues are being addressed right now? If you know, if you think, if you've heard something, different methods, perhaps things that you've seen somewhere else or things that you've heard. I mean, now we've heard of a lot of really great work that is being done around dialogue, around training. Worker unions definitely are a big part of it. CBA, for those who are not aware, collective bargaining agreement, definitely working with the suppliers in cooperation. Grievance mechanism are a big part of addressing these concerns, and we will definitely get to that. Access to healthcare, equitable healthcare, educating the factories, I see here as well. I'll give everyone like 15 more seconds to give us some of your thoughts, to spark some ideas. Perhaps there are things that we haven't spoken about and you think are good solutions or good ways to do this, and would like to see more. Buying supplements, interesting. Definitely like to hear more on that. Okay. Thank you, everyone. I think we can go back now to our panel conversation. Thank you, Michelle. And maybe we can stop sharing, I think, and have all of us stop sharing the screen and have all of us together. I can also unspotlight myself to have everyone together. So first, before we go into our, new questions, I'd like to hear from our panelists a little bit your thoughts on the two questions that we just asked our audience. So first, as you presented, there are many, but what do you think are the most urgent health concerns raised by women, and how are they being addressed at the moment? Mona, maybe we start with you and go to Yiska.
Well, I think all of them, and I also think that they are often interconnected. So when we look at gender-based violence and harassment, mental health, reproductive health, that's like it's really hard to, to make a line there sometimes. So I think, these are the ones that are really like pressing and often neglected, or there's like not so much that is done at the factory level. But then overall, I think that this topic of access to healthcare is also one that is really, really relevant, especially when we're also talking about living wages or wages, and then we see that workers spend like around a third of their already very, very low income on healthcare. I think this is something that is crazy, and also I see here that this can actually be changed quite easily because there is a healthcare infrastructure, but women just do not find the time to go there because they are so overworked. But that's my view. Jiska, what do you think?
Yeah, I think the interconnectedness is the issue, and the discrepancy between opportunities on paper to make choices and the real life that women are in. The time pressure with all the different expectations that just makes it impossible to visit a doctor at the right time when the office is open, no matter what it is. And then, of course, when women talk about their biographies, it's very often topics related to reproductive health. And it's nothing that I want to share here to be dramatic. It's just clear there are some experiences of women, some thoughts around it. So informal knowledge about reproductive health, women saying if you cannot become pregnant and you don't know why, if you stop working in the industry, it'll work. Just this informal, there's no study, we don't know, but it gives you an indication about the worries and health concerns that women have. How do they solve it? I guess that's a question of options then, right? And we have met women that went to the more informal sector because they said mentally I couldn't bear working in the factory anymore. So, but we don't really see the systemic and wide approach that we would like to see for the industry, of course, and that's why we like the project and we believe in it.
Yeah, I think that what you said about access, we kind of many things that you said really resonate. But I think that when we think of access, it says many things, and at the end of the day, it comes down to if you actually have the time to go see a doctor, even if the system is there. Gulden, would you like to add anything to these questions, or I'll move on to our next ones? Okay. Again, I'll move on to our next one. So we're going to start our different set of questions now that we prepared for our panelists. And yeah, we have around 7 minutes for our panel. So if anyone has a question, please drop it in the Q&A box, and we will address it. I'd like to ask Mona and Jiska, where do you see the biggest gaps in identifying the specific health concerns? Because I think that's something that many of our brands deal with, is that it's really hard. They don't come up in audits. They rarely come up in, official documentation. So I want to hear from you. Where do you see, what are the biggest gaps around identification of the problems? And we can start with you, Jiska, and move to Mona.
In my view, it's a lot about relationships, and that's why a focus on such questions. The focus group discussions that we showed, the exercises we're showing the body pain, they worked because there were trustful relationships and a local partner that implemented the studies. And in many audit settings, of course, that is different, and workers have experienced different forms of auditing, maybe in different factories, different scripts, how an audit is supposed to be taken place. So even the fact that something is an audit is raising expectations about everything being fine. So of course you don't detect a particular set of questions. So I think it's a lot about trustful relationships and space for that kind of bargaining that will then result of calling out a problem, because it's not just calling out a problem, it's for a worker. It also means you cannot be negatively sanctioned, and something needs to happen after that, right? So it's not just the detecting, but the whole process of where does the result then go?
I think I completely agree. I have nothing specific to add. It's actually about creating environments that are, yeah, trustful, and also for workers to actually know whom they can approach with issues like that. And yeah, so yeah, leaving it here.
Yeah, thank you for this. I completely agree, and I think that what you showed us in the project is a real testament to the strength of this of these sort of pathways, and it leads us to our next question that we would like to know. So actually, what are the steps, the practical steps that brands? We have many brand representatives here on this webinar. What can they take to make sure that the supplier health policies or practices actually address the needs of women workers without necessarily increasing the burden that suppliers already have and from different requirements? And I'd like to start with Gulden.
Thanks, Leo. But I think it starts with having the holistic approach and the mindset to cover gender lens at brand level, from top level and in all operations that impact suppliers, including like production, purchasing operations, such as ensuring responsible purchasing practices, to cover the gender lens effectively, such as avoiding last minute order changes or cancellations, which directly impact women in lower paid or temporary job positions, and also increase the job insecurity. Having monitoring systems with the integration of gender lens, especially women's health needs like menstrual health, maternal care, reproductive health, or gender-based violence response. And these components should be integrated to current health and safety frameworks or audit question sets and management systems, instead of having repetitive audit systems or reporting systems or additional questions, just to use that what we have already in as monitoring system to embed that mindset, not to be repetitive on this. And effective communication is one of the, I think, important things, like having clear expectations from brand side with the written contracts, written policy and procedures, and communicate them effectively. What else? Companies should be taking responsibility to support suppliers on this matter with capacity building, more capacity building, with trainings or support where needed, perhaps incentivizing for best practices, for instance, on that matter, which helps to reduce the burden of supplier as well. So like in other supply chain practices, I think shared responsibility is one of the key points in here too. As other important points, which I would like to highlight, is women and vulnerable groups representation, for sure, which mentioned by Mona and Iska, which is quite crucial, establishing safe, confidential channels for women workers to raise their identify these gaps, raise their voice on those gaps, and also, especially for gender-based violence issues, then lead for impactful remediation or solution for those issues. I think this is kind of the steps can brands take to and share that with suppliers to eliminate these issues.
Thank you, Golden. I completely agree. I wanna just bring up we have a question from the audience, and I would like to have Mona and Yiska both answer the question that I just asked and the question that we have in the Q&A box. So someone asked, why were India and Indonesia chosen for the pilot? So we'd like to hear that, and also if you want to share anything in addition on the practical steps. We have around 1 minute.
Yiska, do you want to answer why India and Indonesia were
Yes. So in short, because we had good relationships on the civil society side, and we didn't want to focus on one region, because we wanted to compare to see overlaps, similarities, things that might be typical to the industry, not the region. But we really wanted to implement the project with partners that we trust in regions that are important for the sectors we're talking about.
And maybe adding to the question before, I think from my perspective, it would be actually three major points. And I think one is talking to workers, make time to actually go to your factories and talk to workers and have translators and create a trustful environment when you're talking to your workers. Just take time for that knowledge and for that knowledge building. I think this is really important. Also for brands and suppliers. And then I think it's also what Gülden said as well, having a system where women workers are represented and where they can speak up in a factory is also like a really important, point. And also I think what we often forget is the importance of long-term relationships between brands and suppliers, because this is actually something that we see in the project really clearly, that the guideline implementation is a really smooth process when there is a long-term relationship existing and where there's just trust between the brand and the suppliers. So I think that this is something that can be pointed out here as well.
Thank you. Thank you so much for these additions. I think they're all very relevant, and I hope that people were taking notes, because this is all gold information that should be used in factories. Unfortunately, we are out of time on our panel. We could have continued this conversation for around 30 more minutes, I think, even more an hour, because we really just started the conversation on this. And I want to thank you so much. Maybe, Michelle, we can share our screen in the last slide. Just kind of like our closing slide. I want to thank you so much, Mona and Yiska, for joining us for this panel. I want to thank Golden for starting us off and sharing and presenting our work plan on gender. If you have any more questions, feel free, obviously, as always, to reach out to Golden, to myself, to talk more about gender. Our work at FLA on gender is really keeping on and progressing, and we're enhancing it as we go. So please reach out to us if you have any questions or ideas. I want to thank you all again for joining us, and have a great rest of your day.
Thank you so much. Thank you, and also thank everyone who attended.
Thank you, Mona. Thank you, Yiska.